This video was created to review additional risks of abdominoplasty and circumferential tuck surgery, as well as the recovery process. You should first watch the video regarding the risk of surgery in general, as well as general considerations for post-op recovery before watching this one. Please follow along in your written consent forms and pause the video to write any questions you may have so we can be sure to give you all the information you need in order for you to make an informed decision regarding whether or not to proceed with surgery. It's important that you read this information carefully and completely. Please initial each page indicating that you have read the page and sign the consent for surgery in the presence of one of my staff so that they can witness your signature. By signing the consent forms, you acknowledge that you understand the alternatives, risks, uncertainties involved. By signing, you are also stating that your questions have been answered to your satisfaction and that you are requesting to have this procedure done. General information. Abdominoplasty and circumferential tuck are surgical procedures to remove excess skin and fat tissue from the lower trunk and to tighten the muscles of the abdominal wall. Abdominoplasty or circumferential tucks are not surgical treatments for being overweight. Obese individuals who intend to lose weight should postpone all forms of surgical body contouring until they reach a stable weight. There's a variety of techniques used by plastic surgeons for abdominoplasty. Abdominoplasty can be combined with other forms of body contouring procedures, including liposuction, or be performed at the same time with other elective surgeries. Alternative treatments. Alternative forms of management include not treating the areas of loose skin and fat deposits. Liposuction may be a surgical alternative to abdominoplasty if there's good skin tone and localized abdominal fat deposits in the individual of normal weight. Diet and exercise programs may also be beneficial for reducing excess body fat and improve body contours. Risk and potential complications are also associated with alternative surgical forms of treatment. Inherent risks of abdominoplasty and circumferential tuck surgery. Every surgical procedure involves a certain amount of risk, and it's important that you understand these risks and the possible complications associated with them. In addition, every procedure has its limitations. Your choice to undergo a surgical procedure is based on the comparison between the risks and the potential benefits. Although the majority of patients do not experience these complications, you should discuss each of them with me if you want further clarification to make sure you understand all the possible consequences. Specific risks of abdominoplasty, circumferential tuck surgery. Changes in skin sensation. It's common to experience loss of skin sensation in areas that have had surgery due to unavoidable damage to the tiny sensory nerves. For most patients, the changes in sensation improve with time. However, loss of skin sensation may not resolve entirely after an abdominoplasty. Skin contour irregularities. Contour and shape irregularities, as well as depressions, may occur after abdominoplasty. Visible and palpable rimpling of the skin can occur. Residual skin irregularities at the ends of the incisions or dog ears may occur, and does skin pleating when there's excessive residual skin. This may improve with time but may need to be surgically corrected. Major wound separation. Wounds may separate after surgery. Should this occur, additional treatment including surgery and even hospitalization may be necessary. Umbilicus malposition, scarring, or unacceptable appearance or loss of umbilicus or navel may occur. Pubic distortion. It's possible, though unusual, for women to develop distortion of their labia and pubic area. Should this occur, additional treatments, including surgery, may be necessary. Use of platelet gel or fibrin sealants, tissue glue. Platelet gel from your blood and fibrin sealants from heat-treated human blood components to inactivate virus transmissions may be used to hold tissue layers together during surgery and to diminish postoperative bruising following an abdominoplasty. Sealants are produced from donor blood plasma that has been screened for hepatitis, syphilis, and human immunodeficiency virus, or HIV. These products have been used safely for many years as sealants in cardiovascular and general surgeries. These products are thought to diminish surgical bleeding and to improve adherence of tissue layers. Use of drains. During your surgery, I may find it necessary to place 1 or 2 drains. A drain is a small, soft rubber tube that drains fluid out from the area that was operated on. You will be instructed on how to care for your drains. Placement of the drain may require a small separate incision. The drain will be removed in my office when I feel it's no longer necessary. I typically do not close the drain site at the time of drain removal due to increased risk of infection at the site because I want the site open to drain any residual fluid under the wound. Scars. All surgery leaves scars, some more visible than others. Although good wound healing is expected after a surgical procedure, the surgery will result in long, prominent scars that are permanent. Abnormal scars may occur within the skin and deeper tissues. Scars may be unattractive and of different color than the surrounding skin tone. Scar appearance may also vary within the same scar. Scars may be asymmetrical and appear different on the right and left sides of the body. There is a possibility of visible marks in the skin from sutures. These scars may become raised and red in the first few months after surgery, but usually settle down over time. However, some patients are genetically prone to hypertrophic or keloid scars, which means they create prominent raised red scars that do not settle. Further treatments with medications and/or surgery may be required. Injury to deep vital structures. There's an inherent risk of injuring deeper vital structures, including but not limited to bowel, muscles, nerves, vessels, and other intra-abdominal structures. This can be the result of severe infections, bleeding, breathing difficulties, organ failure, and possibly death. These injuries may require additional surgical procedures and hospitalizations. We will now cover wound care and post-op recovery. Please follow along on your discharge instructions for abdominoplasty or circumferential tuck starting on page 2 of the document. Please pause the video if you need time to find this document. Wound care. You may remove your dressings and shower after 24 hours unless you have a pain pump, in which case we will give you special instructions. Have someone with you at least the first time you shower in case you get lightheaded, and be sure there's a place for you to sit down if you do get lightheaded. Replace your dressings with lighter gauze or Band-Aids. You will be safer and more comfortable if you stay in a flexed position at the hips when you lie down or walk for the first 1 to 2 weeks. You need to sleep in a reclined position with pillows under your knees for 1 to 2 weeks after surgery. You will likely need assistance to and from the bathroom for the first few days. If you have drains, empty them twice a day. Every 12 hours, record the output and recharge the bulbs by squeezing them so that they will maintain suction. Please bring the record of your drainage to every office visit. Loosen or remove the binder when you're in a bed or recliner. If you leave it on all the time, your legs will swell and you will be at increased risk of blood clots. Do not apply ice or heat to your abdomen. It could result in skin damage, burns, and loss of skin tissues. Sutures around your belly button will be removed at 2 weeks. If you had liposuction, those external sutures will be removed at 1 week. All other sutures are internal and absorbable. Avoid unnecessary bending or twisting, such as housework, vacuuming, laundry, etc., for 3 weeks. Do not lift more than 25 pounds for 8 weeks. Skin glue remains directly on the scars for up to 2 weeks, if tolerated. If a rash or blisters develop, gently remove the Steri-Strips or skin glue. We will go over scar care with you at your first post-op visit. A responsible adult over 18 years of age should remain with you for at least the first 24 hours after surgery. Call us immediately if you experience persistent or increasing pain not relieved with pain medication, or if you have a high fever over 101 degrees Fahrenheit. Call 911 immediately or go to your local emergency room if you experience shortness of breath, sudden sharp chest pain, especially if made worse by deep breathing or cough, painful respiration, new onset of wheezing without any prior history, or if you experience a seizure without any prior history. We hope this information has been helpful, but feel free to ask questions if you should need more clarification or have any other concerns. Thank you.